Hi, my name is Finesse Stevens, and I will be a senior attending James Ford Road High School in the fall. I was a pharmacy intern at Fairview Hospital this summer, and today I will be discussing the nurse's perception of the value of an automatic drug distribution system, also known as an ADDS, and how it relates to daily utilization. The automated drug distribution system that Fairview Hospital uses is the Pyxis machine. A Pyxis is a medication station that facilitates the decentralized distribution of patient-specific medication. The machine was designed to improve handling of high-risk medications, pharmacist review, drug security, tall man lettering, etc. Also, the Pyxis is a user-friendly automation system with special features to help facilitate safe and efficient administration of medications to our patients. In order for the Pyxis to achieve this goal, it has enhanced special features to help facilitate safe and efficient medication management. Some examples of the special features are the ability to prevent loading of the wrong medication, an active alert to provide an added safety precaution for high-risk medications. To develop the Pyxis perception, a survey was created to touch on the important aspects. The survey was designed to review the nurse's response and how they perceive the value of the automatic drug distribution system. After the nursing staff completes the survey, data will be analyzed and the responses from the nurses will be reviewed to determine the overall acceptance of the technology and areas that could be explored to improve. Pyxis was perceived to have a negative impact on the nursing staff. If nurses were surveyed, then overall results will demonstrate this. If hypothesis was correct, further education will be implemented about the Pyxis and how it benefits patient safety. The methods that were constructed to develop this project were to create an online survey to be administered to nurses at Fairview Hospital. This survey included 13 questions, along with a comment box at the end. After completion of the survey, data was analyzed to see if hypothesis was correct. If hypothesis was proved correct, further education on Pyxis will be implemented. For the first phase of data, the overall impacts of Pyxis on the nursing units were analyzed. Out of 920 participants, 239 responded. 90% will recommend using the Pyxis to other units currently using the traditional method of drug distribution. The traditional method of drug distribution is checking the medication room delivery bin for pharmacy deliveries, 24-hour unit dose exchange, and sorting through a medication bin's contents. Out of the 10% that answered no to the question, it was broken down by the percentage of people that answered no in that particular unit. The second phase of data was analyzed by the comments that were left. They were categorized by the main issues mentioned about the Pyxis. There were 6 categories, 5 were about the Pyxis, and the other comments were about issues within the hospital. According to the data, positive comments were the second largest category. The third phase of data was to record the patient safety. For patient safety purposes, nurses should remove one patient's medication at a time. Responses and physical audits identify that this practice is not followed to different degrees on different nursing units. With this research project, our hypothesis was disproved. The overall perception of the nurses responding to the Pyxis was positive. No further education needed to be implemented on the nursing staff because of their positive response. Out of the 90 nurses that openly commented, the category of positive comments displayed in data phase 2 was the second largest category directly related to the Pyxis system. According to data, there was no correlation between being technology savvy and a nurse that felt like more training was possible. Overall, nurses would recommend Pyxis to other units currently operating with the traditional method of drug distribution. There are a few things to recommend to the nursing staff at Fairview Hospital. Try to improve patient safety by taking out one patient's medication at a time. This causes fewer mistakes on treating the wrong patient. Creating an ad hoc committee would help resolve the issue and enforce organization. Some units, such as OR and oncology, feel the location of their Pyxis is inconvenient. Therefore, further evaluation should be implemented. Some medications located in the Pyxis are rarely used, so inventory on Pyxis should be continuous. Nurses believe that most medications should be on an override list, but there are certain criteria that have to be followed. With the pharmacist checking the medications before they are delivered, it saves more time and is available to the nurse on hand. I would like to thank my mentor Michael Hoying and my co-mentors Donald Zabriskie and Chris Holzman for teaching me all about clinical pharmacy and contributing their helpful ideas for me to be able to complete my research project. Also, Linda S. Thomas for assisting me in making sure all my information about my project to the nurses was accurate. To the Fairview nursing staff for participating in my project, and the Cleveland Clinic internship for giving me the opportunity to advance my knowledge in the healthcare field. To the Office of Civic Education Initiatives, I thank you for giving me the opportunity to be a part of this program. Last but not least, my peer mentor for being a great help with my project and making sure everything was organized. Thank you for taking the time to listen to my presentation.